Melanoma is a serious form of skin cancer that has, unfortunately, become increasingly common. This year alone, more than 76,000 new cases of melanoma will be diagnosed. Let's discuss what you should know about this potentially deadly skin disease. Melanoma is a cancer of the pigment-producing cells in the skin, called melanocytes. These are the cells that also form benign tumors in the skin, which we commonly know as moles. Melanoma can be caused by a variety of factors, the most important of which is exposure to the sun. Exposure to the sun over time, or frequent blistering sunburns during childhood, can be a strong stimulus for melanoma development. Tanning, as we've come to know, is also an important risk factor for melanoma, and in fact increases your risk of melanoma by upwards of 75%. There are also some genetic causes of melanoma, which are less common but important if you have a strong family history of melanoma. The only way to prevent melanoma is to entirely avoid sun exposure, and even that can be ineffective as melanomas can develop in places where sun exposure doesn't happen. Sunscreens with an SPF of at least 30, which are broad spectrum and water resistant, can be an important tool and have been proven in studies to prevent skin cancers, including melanoma. The most important tool for not preventing melanoma but catching it at a treatable stage are skin self-exams. We instruct patients to watch for the warning signs of melanoma using the ABCDEs. A stands for asymmetry, so a mole where the left doesn't look like the right. B stands for border, so melanomas often have irregular or scalloped margins. C stands for color. Melanomas are often dark in color or have multiple colors. D stands for diameter. Most melanomas are bigger than 6 millimeters, which is the size of a pencil eraser. E is probably the most important and stands for evolving. So any mole that is changing in size, shape, color, or symptoms, including bleeding, itching, or pain, should promptly be evaluated. Unfortunately, this deadly skin cancer is becoming more and more common. For people born in 2014, an estimated 1 in 50 will develop melanoma during their lifetime. Additionally, it has become the most common cancer among women aged 25 to 29. As this cancer becomes more common, prevention and early detection are key.